All right, so what organ is this?
The heart.
Uh-huh. How about these?
The lungs.
Lungs, exactly. Cat lungs are 3 on the left, 3 on the right. They have a 7th intermediate one down here by itself. But they are, for the most part, if you're just talking about their 2 lungs, are 3 and 3. Humans are 2 and 3. Okay? So a little bit of a difference. All right, this organ?
Trachea.
Trachea. What is behind the trachea? Yep, the esophagus. This tube right here. Okay. Now, you know, danger Batman. The this thing is, people always want to assume it's a blood vessel. Okay. Hint, hint. That's the esophagus. So if on any exam in your future life, if you see something pulled up behind the trachea and tagged, don't assume it's a blood vessel. This is what I'm saying.
Esophagus.
It's there's the esophagus there. Okay, so then we come down. What is this organ?
The diaphragm.
Diaphragm, exactly. This big brown one.
The liver.
Liver. This little bag.
The gallbladder.
Gallbladder. This big bag.
No, the stomach.
Stomach. Yep. This is less. That's lesser omentum, but there was one sitting here.
One.
Greater omentum.
Greater omentum. I know it's in the way, huh? If we lift the stomach up, and we can see in the lesser omentum here, this organ.
Pancreas.
Pancreas. You got it. Most.
Spleen.
Oh, very good. Thank you. This organ?
Kidney.
Be specific.
The left
Kidney.
Right kidney.
Right kidney.
Right kidney. All right, the small diameter tube here.
Small intestine.
How about these spiderwebby looking things?
Mesentery.
Mesenteries, exactly. Okay. This long tube?
The large intestine.
Large intestine. And large intestine and small intestine meet up with each other. Here, yep. So this bag out under my thumb, that's the cecum. Okay, the cecum belongs to the large intestine, but there's cecum. Okay, we go down. This thing that sits
bladder.
Right, it is the bladder. Okay, both boys and girls have one. So the temptation is to think that that's a uterus, because in humans it would look like one, but definitely not a uterus. So, do you guys have a girl anyway? Where did uterus go? Speaking of a uterus, okay.
She had a hysterectomy.
I'm wondering, but yeah, definitely bladder. I'm not seeing a uterus, so I'm wondering. That, yeah, there may have been a. You would have noticed. It would have been Y-shaped. It would have come up here and had 2 long uterine horns. So imagine a big Y sitting here. You'd have noticed it.
We didn't see
So I don't think you
anything
cut
like
it
that.
out. It's entirely possible it was fixed. It was spayed, and so it's not there. Okie
Looks like
doke.
it has sutures right there.
It does.
Oh, that's from the embalming process.
Oh,
That's
okay.
what yeah. Okie doke. So those are all its major organs, correct? Okay. Now we're gonna go do blood vessels. So let's go do the superior ones. Let's do venous system first. What's this big blue thing?
Superior vena cava.
Superior vena cava. There's one back here, running dorsal, a little branch off of it. Where'd it go? There it is. See it poking out there?
Nope.
It's
Yeah,
right
it's
on
right
top
there
of the
to the
probe.
side.
There's a vein right on top of the probe. That's azygous vein.
Oh, that's the azygous.
That's the
vein.
azygous.
Okay.
So azygous will drain posterior thoracic wall.
Okay.
On the superior vena cava, there's a little branch in here. Here it is. Okay. You had no choice. When the rib cage had to be opened, it was going to break. This is the internal thoracic vein. It drains the anterior thoracic wall.
Okay.
So that means that superior vena cava had two converging veins on it. So again, azygous. And what was this one?
The
Internal thoracic vein. So superior vena cava comes up, branches into brachiocephalic veins. Brachiocephalic veins branch. In this kitty, in Dextor, this big one here, that's an external jugular vein. And then the other branch becomes the subclavian vein. I think it's just better on this side. So here's his external jugular vein. And then this is his.
That's the right.
Yes, ma'am. I was just going to ask. That is his right subclavian vein and his right external jugular vein. Cats do have an internal jug. It usually comes right about here. It's just really, really skinny. So sometimes you can't even see it because it just tears as you're doing dissection. In fact, that's it right there on this side. So if he has his left, we can see it a teeny bit. See how skinny that is? So the skinny one becomes the internal jug. The fat one is the external jug. Humans are kind of the opposite.
Okay.
All right, so if you follow a subclavian, when you get to where the subclavian hits, lines up with the cat's cheek, that's actually its armpit. So what do we call it then?
Axillary.
Uh-huh, so that would have
axillary
been, yes
vein.
ma'am, that would have been his right axillary vein. And then what is it in the arm here? Right. Brachial vein. Even we're not seeing one, but it would have been there. And then forearm? Radial and ulnar.
And ulnar
Okay.
vein.
Radial and ulnar veins. So now let's look at the arterial system. A lot of the names are going to match. It's not a mirror image of itself. The branch pattern doesn't match, but the names are going to match. Okay. So we know ascending aorta really short, then aortic arch, then descending aorta. So the aorta itself does not go far past the heart.
Can
you say that part again?
Ascending aorta, aortic arch, descending aorta, and this is the thoracic aorta. So it's down there behind his lungs. So the aorta has two branches in cats. This is one of our few differences. Okay, humans have 3 branches off the aortic arch. Cats are going to have 2. So the first branch is the brachiocephalic artery, and their last branch is their left subclavian artery. If we follow the left subclavian artery, right, comes up, hits his cheek. Now what are we going to call it? Yeah, that's his left axillary artery. What is this? Left brachial artery. And then when in the forearm, you would have had the
Radial and
ulnar arteries.
radial and ulnar arteries. If we go to their brachiocephalic, we're going to see that their brachiocephalic will have 3 branches off of it. Ours just has 2. Okay, because their brachiocephalic has to make up the missing link, so to speak. So their brachiocephalic comes up, and it's going to branch into a left common carotid artery and a
Right common carotid.
right common carotid artery and a should be in there right subclavian artery. Okay. Right subclavian hits the cheekbone. We're going to change its name. Now what are we going to call it?
axillary.
Right axillary artery. What is it in here?
Right brachial.
Right
Right brachial artery. Hit the elbow and it branches, and we get the what?
Radial.
Right ulnar artery
ulnar and radial
radial artery.
So those are the superior vessels. Okay. So now if we go and look at the inferior vessels, we were saying we're going to use, this is where Dextor just gets so pretty. Okay, we're going to use the diaphragm as a landmark. So we can see the abdominal aorta coming down here. Okay. And this is the first branch off the abdominal aorta. Okay, celiac artery. This is second branch.
Superior mesenteric.
Superior mesenteric artery. Here are the third branches.
That's the renal artery.
Which renal artery is this?
Left renal artery.
That's his left renal artery. We come down. We've got this branch.
Inferior mesenteric artery.
Inferior mesenteric artery. You got it. And then we have these branches.
Iliolumbars.
Yep.
Left and right.
Yep. The left and right iliolumbars. And then their aorta branch down here is different from ours. So their aorta comes and makes a split.
Exterior iliac.
Is she correct with the exterior? External. Right, you're on the right track. So external iliac arteries. Then you get a teeny bit more aorta. Then you get an internal iliac artery. Okay. The
left.
Exactly. So that external iliac comes down, pops out the abdominal wall, and then we start to call it a
femoral artery.
Yep, femoral artery. And then the femoral will branch down here into 2.
Popliteal artery.
Oh yeah, you're correct. Popliteal behind the knee, and then in the shin we have 2 branches.
Tibia.
Anterior and posterior tibial.
Okay.
So that's it, their arterial system. Okay, and what's nice about Dextor is you guys went through the effort. We're not going to flip them over, but you guys went through the effort, and you can see really nicely on his celiac, you can see his 3 branches. And if we take the time and you flip them over, you'd see the vessels it goes to. Yeah, they did a beautiful job. They did a beautiful job. All right, so, yeah, but they also did a beautiful job. Okay, so now let's look at the venous system. So we have inferior vena cava coming down. Remember, not as many branches directly onto it. Okay, so we have the renal veins. Okay, go down. You have iliolumbar veins. Their branching pattern matches ours. So it goes common iliac, internal iliac vein, external iliac vein. External iliac vein comes and pops out the abdominal wall, and it becomes the femoral vein. And then this is a branch that's superficial.
Great saphenous vein.
Great saphenous vein. They're going to share their video with you. Femoral vein goes behind the knee, and we call it the
Popliteal vein.
popliteal vein. It branches, and you have an
Posterior, anterior.
yeah. So posterior tibial and anterior tibial vein. Okay.
Left.
Exactly. Okay. All right. Then the last system you had to go after was the portal vein, and again, they did a beautiful job getting it out of Dextor here. Okay. So I'm going to move it a little bit. Let's see if we can get all of its parts. Let's see if we can find the easiest place to look at it. Here we go.
Look at that stomach. Ooh.
So this vein is going toward stomach and spleen. Okay. And we even see they even went so far as to get his branches out. Okay. So we figured out splenic vein, gastric vein, gastrosplenic vein. This vein is coming from the the small intestine and the proximal large intestine. That's the superior mesenteric vein. So superior mesenteric, yeah, and this is inferior mesenteric. See it branching come down here? So it goes inferior mesenteric vein, superior mesenteric vein. Converging onto the superior mesenteric vein is the, what is this again? Gastrosplenic vein. And so notice how they converge to make one vein right here. Hepatic portal vein. Okay, and the blood from there would go into the capillaries of the liver to be processed. Yeah, liver right up there. And then after the hepatocytes are done processing it, it'll drain out of the liver on hepatic vein. Yep, and then hit the inferior vena cava. It's a wrap. That's a wrap. That's a wrap.